Hi, hello. How are you? Nervous? It's okay. Being nervous is common, and I'll assure you that you're going to be okay, okay? My name is Nurse Price, and I'm here to discuss with you the surgery that will be performed today, okay? First off, to ease your mind, you're in great hands. Being anxious is common to have, and the oncologist is really specialized in this. So he deals with many patients who have severe skin cancer. As far as I'm known, Dr. Smith has done these surgeries over 20 years, so I guarantee you that you're going to be okay, all right? Have you heard of the surgery that will be performed today? No? Okay, that's fine. Let me explain. It is called the Mohs surgery, which is a procedure that treats the skin cancer. This treats the two most common types of cancer, which is the basal cell carcinoma as well as the squamous cell carcinoma. To begin with the procedure, the surgeon will start by removing the tissue that is cancerous by each layer using a scalpel, which is our surgical tool. And then he will then cut the tissue into sections and then diagnose the cells by viewing them under a microscope. And then this will determine if all the cancer cells have been eliminated in your integumentary system, which is the deeper layer in your skin, okay? This procedure is 100% safe and effective, and you will not feel any pain, I promise you, all right? After this procedure, the surgeon will then close you with stitches. And then I will say that this procedure may take up to 4 more consecutive hours if there is a plethora of tissue needing to be removed. So if you feel any pain or discomfort or bleeding after the surgery, do not hesitate to call or immediately come back if it is really severe. It is also important that you keep the wound covered with a bandage and that it stays moist, including the gel that is prescribed to you, and then we'll talk about that later on. Also, make sure not to be exposed to any sunlight, okay? And then lastly, you'll experience a bit of scarring after the surgery. And then with this, you want to gently massage your stitches around 2 to 3 times a day for 10 minutes, okay? And then this will help soften the tissue and then promote the faster healing results. Any questions or concerns you have with me? Great question. Okay. Healing takes quite a while. So your stitches will dissolve around 14 days. And so with this, you'll make another appointment so that we can see how the healing process is going. Overall, I would say the healing process might take around 6 months to a year. I know, don't get discouraged. Healing differs for different others, okay? All right, well, let me go ahead and put in your documents and we'll go ahead and start. All right.